The Ethics in Psychology podcast is created by my dad, Dr. John Gavazzi, a psychologist. The podcast deals with issues related to psychology, ethics, philosophy, and morality. He is going to interview people so that listeners can become better psychologists. Please enjoy this podcast.
Always do the right thing.
That's it?
That's it.
I got it. I'm gone.
Welcome to the Ethics in Psychology podcast. I'm your host, Dr. John Gavazzi, psychologist, board certified in clinical psychology, and this is part 3 of supervision of psychologists in training, psychologist as supervisor. We will be going over new skills and ethics for psychologist as supervisor. This is an extension of parts 1 and 2. This is the final section of supervision. So this episode is not a standalone continuing education course. For CE credit, you will need to listen to all 3 presentations, then take the post-test. There is no separate CE for each 1-hour presentation. In terms of today's overview, we're going to be talking about informed consent, which overlaps a great deal with the supervision contract. We will be defining competence. We will be looking at essential competencies for supervisees. We will be addressing the use of self-reflection in supervision, and hopefully if we have time we will discuss relationships, challenges, and remediation in the supervisory relationship. So the learning objectives for today are the same as in episodes 1 and 2. You can look at those while we have our guests introduce themselves. First, we have Don McAleer, a returning podcast guest. Don, can you tell us a little bit about yourself?
Hello, John and Sam. I'm a practicing psychologist, neuropsychologist here in Erie, Pennsylvania, part of a interdisciplinary group called North Shore Neurosciences, board certified in clinical psychology. And as part of the diverse services we provide here at our practice, we also have an APA-accredited internship and also have postdoctoral trainees stay with us often after their internship year to go on and get the necessary supervised experience to allow them to sit for licensure.
That's wonderful. And Don, that's why you're here. We need somebody with that level of supervision experience who's actually done the contract, so you do have value.
I'm touched.
And Sam, you're a returning guest from episode 2, and you helped pull together all of this information about supervision. So what do you have to say to the folks out there?
Always glad to be here and looking forward to a good conversation.
Great. So as I said, we'll be talking about informed consent, which will overlap with the supervision contract. So in terms of informed consent, and Don, I'm going to just read over a couple of these, but if you can then jump in. So we're going to be looking at the conditions of supervision, client privacy, disclosure of trainee status, documentation of consent, job duties and required experiences, evaluation, supervisee privacy, supervisor credentials and theoretical orientation, hopping to the next one, supervision boundaries, multiple relationships, supervision exploitation, supervision power differential, required self-disclosure, personal growth activities, and fees. So sorry that I went over those so quickly, but Don, fill some of those in for us. What do you think are the important components here?
Obviously, John, they're all important, but in looking at the informed consent for supervision and for the postdoctoral year, we usually melt these together in terms of a contract that covers, as far as conditions of supervision, the number of hours that are going to be required, although this probably goes into other aspects as well, but some of our interns are looking for specific types of training. For example, in neuropsychology, someone else might want to do more direct clinical work. So we not only talk about the conditions of supervision, which would be number of hours of supervised experience per week, how many are group, how many are individual, who those supervisors are going to be, but then also teasing out what types of training experiences the person is going to want to have during their year with us. We also talk about the nature of the supervision, to avoid the possibility of multiple relationships going on. Some supervision is perhaps a little more didactic. Some of it might, for some people, might be geared a little bit more towards professional growth and identity development as a psychologist. Sometimes supervision takes on a quasi-therapy role. We would certainly want to disclose that up front if that is something that the intern wishes to partake in. But it's unlikely that we would want to emphasize that. We also discuss evaluation policies, and we have a what we refer to as a competency assessment form that actually goes through various areas of clinical practice, such as legal ethical matters, supervision, psychotherapy, consultation, and so forth, and allows us to rank the person as far as their level of competence in that. So I see it as a good foundation for getting someone started in their postdoctoral year.
Sam, what are your thoughts on some of these aspects of informed consent?
Well, I think this is very good summary, and some of them are mandated by state board regulations. For example, informing patients of the trainee status is mandated by the State Board of Psychology. But this is a good list because it also helps describe what the supervisory experience is actually like.
Don, how much do you go into your own credentials and theoretical orientation as part of informed consent? Do you do a lot of that?
Relatively little. The main factor in that is that all of our postdocs that we've had so far have already spent a year with us as a pre-doctoral intern. So in essence, the intern is pretty well familiar with the theoretical background, the training experiences, and so forth of the 7 people here in the practice. To a certain extent, the postdoc resident has an option to choose one of us as the primary supervisor. So, for example, this year I have a postdoc resident who actually kind of picked me, but then as a secondary supervisor, she picked one of the women in our practice, one of the female partners in our practice, in order to try and get also the perspective of a early career female in the realm of psychology. We don't necessarily emphasize that, but again, because they've been with us for a year, they pretty much know what the people do and what our background is and how we approach things.
That sounds like a real advantage.
Mm-hmm. Yeah. Well, and it's an advantage to us too, because we also know the strengths and weaknesses of the resident coming out of their pre-doctoral program, and have some ideas of where their passion is and how we can best guide that into developing a professional psychologist.
I don't want to go too far afield here. In the previous episodes, we talked about some postdoctoral experiences that folks had that were not optimal and how to best deal with that. So it sounds to me very advantageous, right, to both you and the intern to know what you're getting yourself into. That actually sounds like a very good model for perhaps other people to emulate.
It all depends on whether you think you can do it or not, and it becomes really quite a what I mean by that is it all depends on whether you can make it happen logistically, and sometimes it's a little easier than you thought it would be, but it also requires a commitment on your part for time and effort. But yeah, it really is a nice program. What
do you require in terms of self-disclosure?
Talk a little bit more about that. What are you thinking?
Well, in terms of, and again, I'm jumping back into episodes 1 and 2, we had some discussion about self-disclosure on part of the resident or psychologist in training. The idea was that some self-disclosure would actually be very good.
Well, John, if I could jump in here, my perception is that the goal is for self-awareness and self-reflection among the supervisee, and I would look at the required self-disclosure along those lines. If it facilitates self-awareness and self-reflection as a professional psychologist, then it would be required. If it doesn't, then it's not something that you would go into. It's just a general rule of thumb. It's impossible to establish a bright line as to where that would be, but I think that would be the general rule to follow.
Yeah, I guess I would agree with that. We don't require anything per se, but we've had circumstances, and I'll go back a number of years now, where one of our residents was having a little more than expected problems with organization of reports, and that intern eventually did disclose that they did have a learning disability that was unknown to us at that point. What it did was it allowed us then to adapt and design the supervision to be more meaningful to them. The person ended up doing quite well with it. The kind of things that they required were maybe a little more time. They needed to be able to talk things out first before they were written, as a way of kind of organizing their thinking a little bit better. And once we were aware of that, then things really smoothed out very nicely.
I think that's a great example. Don, we talked about this ahead of time, and you've graciously agreed to send a copy of your contract with your postdoctoral supervisees.
Many of our we don't have a single document. We have a number of different documents. So I'll try and pull those together and send you a copy of those, John, so they can be made available to the listeners. The one thing that we do that I will also include, APA has been very strong on this, particularly in the pre-doctoral internship area, is assessing competencies. The idea of just ranking somebody on a Likert scale of 1 through 5 really isn't quite good enough unless you also have some type of behavioral anchor. And so we have a psychology trainee, I don't know if you can see this, but a psychology trainee assessment form.
Awesome. Yeah, I'd love to put that up.
Yeah, now this is not ours. We actually borrowed this, the Chicago VA health system. And this is really quite nice because it delineates areas of competency such as professional conduct, ethics, and legal matters, under which then there are a number of behaviors such as professional interpersonal behavior, seeks consultation, supervision, uses positive coping strategies, professional responsibility and documentation, efficiency and time management, knowledge of ethics and law, and so forth. And then under each one of those, there's competency rating descriptors ranging from advanced skills to needing remedial work, with several in between. So we'll include that as well, because that helps to also clarify. We use this in supervision. We have the residents rank themselves, and then the supervisory ranking, and then we compare where they think they are and discuss areas for improvement. So I'll include that as well.
Okay, great, because we're going to be talking about competency in a little bit, and maybe we can get back to that. Mm-hmm. But in terms of the contract, though, like you said, many of these, you have your interns, they're already aware of that because they're working within your system.
That's correct.
So they understand your background, what the responsibilities and requirements are, what their responsibilities are, potential supplemental requirements, confidentiality policies, documentation of supervision, which you're already talking about with some of the assessment forms, financial policies, risks and benefits of supervision, the evaluation process, what you talked about, complaint procedures and due process. I'd like to come back to that. Professional development goals and duration and termination of supervision. So those are all good things to be putting in the supervisory contract or supervision contract. But in terms of complaint procedures and due process, since you do this, is there a procedure that you have in place for this?
Essentially what we do, John and Sam, is utilize the same complaint and due process procedures that we have in for the pre-doctoral internship. So that's a clearly delineated policy, the graduated steps of due process and the right of appeal and so forth.
Okay, great.
So it's essentially the same one that we use for our pre-docs.
Sam, what are your thoughts on the components of a supervision contract?
Well, I think these are very good. I did have some thoughts about theoretical orientation.
Okay.
Don, I'm remembering a meeting we had in Harrisburg where internship directors such as yourself spoke to doctoral trainers about what they were looking for in the ideal candidate.
Mm-hmm.
And I remember that theoretical orientation really, from the standpoint of the internship directors, really wasn't that important. But the important thing was the willingness of the supervisee to be receptive to feedback and be willing to self-reflect. And one of the panelists said, if someone comes in, they already know what they're going to do and don't want to change anything, fine. They can go someplace else because I'm not going to be able to help them. So I think that's, and John, I think we mentioned in episode 2 where as a supervisee, you chose a supervisor with a different theoretical orientation because you liked his interpersonal style.
Right.
And it was an opportunity for self-reflection on your part.
Right, and it was an opportunity to get a different theoretical perspective, and hopefully the idea was to expand on what my level of comfort would be with a different theoretical orientation. So
for some students or trainees, theoretical orientation might be like a really, really big deal, but I'm not sure it really should be.
I can honestly say that in our experience with our postdocs, it never really has been a big deal at all. And of course now we have a self-selected group of postdocs coming through because they've chosen us as an internship site. And so they do realize that we do a lot of medical psychology, neuropsychology, medical consultation, and so you're right, Sam. The therapeutic orientation or philosophical orientation has never really been that much emphasized, as much as the openness of the person to learn and to perhaps integrate a new way of thinking into their way of thinking, and so for us, it's been more of the openness of character of the intern or the resident that's been important.
Excellent. All right, well, let's jump ahead then, since we'll have some resources on the Ethics and Psychology site for both interns and folks who want to do the postdoctoral supervision. Let's move on to defining competence. So what we're looking at in this section is having the supervisee develop as a psychologist. Now, Epstein and Hundert define competence as the habitual and judicious use of communication, knowledge, technical skills, clinical reasoning, emotions, values, and reflection in daily practice for the benefit of the individuals and communities being served. So why is that such a great definition for you, Sam?
It has 3 components. The first is that competency is both habitual and judicious, which means it's a habit that you engage in every day, but also it's judicious in that sometimes you have to use special judgment. It has components, and they list several components. It isn't a comprehensive list. We could add more, or we could combine them in some way, but it kind of gets at the basic components. I like the idea of including emotions, values, and reflection as the components. And also you look at the target, which is the individual, which is a patient, but also the community in general. So that's why I like this definition.
So it's very comprehensive from your perspective.
Yes.
And so when we're looking at supervisees becoming psychologists, there are different ways of viewing this. So there's the what, and there is the whom. And Don, you started talking about this at a little bit more of a specific level, but the what includes issues such as communication, knowledge, technical skills, cultural competence, clinical reasoning, emotion, values, and self-reflection.
Yeah, that's exactly right. In order to be a professional psychologist, you have to have a certain body of knowledge that is beyond the capability of the average person to understand, a certain methodology and body of technical skills, and then to be able to use those technical skills in combination with the knowledge in a clinical reasoning process to be able to come to some diagnosis or formulation of the client's condition, and then again some knowledge about how to take that person from where they are to where they'd like to be, and then most importantly, I think, to be able to communicate that in a clear and effective fashion to the client, to interested parties like family members, to help affect the change in understanding. Absolutely, I think that this makes a lot of sense, John, in terms of looking at the overall picture of what are we training people to be able to do.
Sam, some of your thoughts?
Yeah, I think these are good. These correspond roughly to the clinical competencies that Don is referring to. Like I said, you can split these up and combine them in certain ways, but if I was to create the list, it'd be slightly different, but this is fine for discussion purposes.
Right, and I think that doing continuing education for a lot of psychologists, I think that the emotional component and the values component, those are some of the things that I focus my trainings on with ethics and morality, and I'm amazed at the number of people who come up afterwards and talk about the issue about values, and there's not enough clinical psychologists talking about values and how values impact the psychotherapy relationship, and how many times psychologists underestimate how their own values influence their daily lives.
Well, and that's why I like, John, the component here of self-reflection or self-awareness or even self-care as how it all impacts in this as well. We spend a fair amount of time in the supervision sessions with the postdocs talking about this kind of thing. Again, with the postdocs and also our pre-doctoral interns, they are seeing multiple supervisors, and some of the supervision is much more knowledge and technical skill based, perhaps focusing on writing skills and communication. But then other supervisors will take the time to discuss some of this professional identity, values in psychology, the role of self-care, self-reflection, understanding one's own emotional reactions. As an example, once a month we have a professional issues and ethics seminar that is attended by both the the pre-doc as well as the postdocs. And we talk about things like what's happening in the field of psychology at the professional level, but then also more of the cultural and developmental role of a person as a psychologist, conflicts that they might run into, where the professional code might say one thing, but yet common sense and intuition tells you to do something different, and how do you resolve those kinds of conflicts?
Sounds like a great monthly activity.
They always have something to talk about.
I'm sure they do.
And you deal with a lot of very difficult issues, Don. You deal with competency for a person to understand a medical procedure. You deal with dying patients.
Right.
You deal with a lot of situations that do evoke a lot of emotions that people need to think about.
Well, that's right too, Sam. And you know, in particularly in some of the office assessments that we do, we have to give people bad news that you've been diagnosed with a dementia, and you're an aggressive dementia, and you're 56 years old, and the intern and postdocs have to wrestle with those kind of you want everybody to be happy, and you want to have someone walk out of your office with a smile, but there are times where that's not possible. And so how do you do what is the correct, right, and proper thing to do, and be able to do it in a professional fashion that respects the patient, the client, and helps them to move forward with whatever they have to deal with. That has come up on frequent occasions.
Those are tough conversations, absolutely.
And John, when you do CE trainings, I think you do self-reflection a good deal. Self-reflection on values and emotions.
And we're going to be hitting self-reflection a little bit later, so I'm going to keep my powder dry till then.
Okay.
Then the whom is, again, this is fairly obvious, though, patients, couples, families, and we included the general community in case the psychologist, the supervisor, wants to take the postdoc out when they do perhaps community education. So it is good for psychologists to get themselves out in the public, Don, as you said, to help people understand the difference between folk psychology and professional psychology. Mm-hmm. And when we go out and educate the public, we talk to them about things that might be counterintuitive, because many folks are running around, and saying that redundantly, many folks are running around with folk psychology. So it's good that interns experience that, or postdoc folks experience that and are part of public education. Again, not a requirement, but something that might be helpful.
Well, John, the interns as well as postdocs are doctors in training, and what you hope is by the time that they're finished with this, that they will feel competent to function in just about any setting clinically that they find themselves in, but also that they've embraced the role of a professional and the function of a professional in the community, which is someone that may be seen as a leader, a resource, someone that can be accessed for questions that are beyond the scope of what the average person thinks about. So you certainly hope that.
Yes, absolutely. So as we talk about competence, we want to talk a little bit about moving toward excellence. And Sam, you were the driving force behind this slide. So can you kind of take us through the slide as to what the slide's trying to communicate?
There's formal regulatory standards set by the State Board of Psychology or the APA Ethics Code, which set minimal standards for competence. And you go through the State Board of Psychology regulations, and you have the checklist. These things have to be done in order to get supervised, and you get licensed, and supposedly you establish that it's a minimal level of competence. But we don't want to be just minimally competent. We want to be really good at what we do. We want to excel, and that requires internal and informal standards. And Don was talking about the attitude, the professional attitude on the part of the trainee, where they view continued professional growth as a habit and part of a lifestyle. And here's some ways that they can do it. Feedback, and soliciting feedback, and actually processing feedback. Now, Don's in a group practice where informally, I'm sure, the partners provide feedback to each other all the time. If one partner were to be slipping for some reason or appearing to be distracted or something, the other partners will say, "What's going on?"
Right.
And I can't speak for the partners in the practice, but maybe that's one of the reasons they self-selected themselves into a practice, because they can provide a higher quality of care by working as a group, by having that kind of feedback. And there's some evidence with physician practices that when there's a positive atmosphere in the physician's practice, where every staff member feels empowered to assume responsibility for patient care, the quality of patient care actually increases. So the nurse feels empowered to tell the physician, "I'm not sure this is the right thing," or "I don't understand this order. Are you sure this is the right thing to do?" And when you have that kind of continual feedback, the quality of patient care is improved. There's nothing that's embedded in the State Board of Psychology regulation, but it actually relates to quality of care. So, response to input to reflect, filter, assimilate, ignore. There's a study on physicians where they were assessed on objective protocol dealing with patient care. They also were asked to rate how well they did. Most physicians rate themselves slightly higher than they actually performed. This is a fairly universal phenomenon. Most people overrate how they do slightly. But there's a subset who did poorly, yet rated themselves as being extremely high. Somehow they develop cognitive structures that allow them to reinterpret or somehow misinterpret negative feedback. And these are the people that we worry about. So we want people who are receptive to feedback know how to accept it in a meaningful way.
Right. And I think the way that this is set up as well, at least this is one of my takeaways from the chart, is that these external or formal ways of thinking about movement toward excellence do not focus on individual drive, individual motivation, right. And these things are all external. And my hope, and this is what you spoke about earlier, Don, is we're trying to help these folks develop a sense of identity. What is the role of a psychologist, not only in the office but in the community? And many of these things are looking at your own personal development in terms of professional development. But I think that there is a whole nother component to this as well, where individuals are developing to be part of a community.
Well, and I hadn't thought about this too much until I looked at this slide in anticipation of today's call here about the informal nature of things. And one of the things that does happen both with interns as well as postdoc residents is they are watching us. They are picking up on attitudes of methods of professional interaction. As you mentioned, Sam, in the group here, it's kind of like a polygamous marriage. We have 7 partners who are kind of all married together, and so you have to be willing to be able to say things to people like, you doing okay, or geez, you really you were a little edgy today about X, Y, or Z, but done within the context of a respectful discussion. And that's something that in developmental movement that the intern has to see as well. And I think they pick it up in these more informal ways through our own role modeling as well.
In medicine, that's referred to as the hidden curriculum. And it takes conscious effort to create that positive organizational culture, but it really is very important. And I was consulted on one internship site, not yours, Don, but another one where an intern was doing well with patients, getting along okay with other staff people, but the secretaries hated him because he was abrupt and arrogant and perfunctory with them. And the supervisor intervened immediately and said, organizational culture is important. The feelings of the secretaries are important. This is related not only to their well-being, but patient care. I don't want to have secretaries being upset because of you, when they end up having to talk to the patients in the waiting room. Straighten it out.
That's interesting, Sam, because in our internship over the years, we've had 1 or 2 occasions where the intern has gotten a little huffy with the staff. They're better trained and so forth, and we've had to intervene in that same kind of way. So again, the idea of role modeling and setting the tone for effective professionalism is really important.
And I'd like to give just one other example, and then we're going to move on. A local hotel was recently written up in the local paper because they got new management, and part of what the management was directing folks to do was that everyone is in charge of guest relations.
Yes.
It's not
Absolutely.
just the front desk.
Right.
So
Absolutely.
security officers, the cooks, the waiters, everybody was in charge of guest relations. And they gave the example of how one guest was on an elevator and the security people said, "How are you enjoying your stay? And is there anything I can do to make your stay better?" And for these people, it really made a huge difference. Well, they're like a local success story, but this is what we're talking about, creating a culture where everybody is involved with treatment of the patients. And so, unhappy secretaries means that there could potentially be some rifts in the office that might not allow people to perform to their best potential.
And there's a book by psychologist Barry Schwartz, and I'm blocking on the title of the book, but he describes in hospitals some very moving examples of how the behavior of the custodial staff was extremely sensitive to the needs of the patients and the patients' families, and really made a very substantial difference in the quality of the experience that they had.
Right, absolutely. And maybe one of the CE test questions is going to be true or false. Is Don McAleer in a polygamous marriage at work? Okay.
We'll ask the partners.
Moving on. Potential areas of supervisee development. And Sam and I put together a list of areas to focus on. And these include many of the things that we've talked about already. Competence, ethics, emotional awareness, cultural issues, diversity, intervention skills, assessment skills, professional identity or autonomy, as well as motivation for moving forward as a psychologist. Any of those areas, Don, that you want to address?
Well, I would agree with all of them as the core. I would add other ones that we also look at of scientific inquiry, to be developing an area of competence in that, professional consultation, which I suppose is kind of a identity and autonomy, but also how do you see yourself fitting into the larger picture of a health care professional. Basically I agree with all of these things. I would just add a few more to them.
Sure, and that's what the idea. Feel free to add to the list. So yeah,
I saw that.
Yeah, this is right. Not meant to be comprehensive, but right. These are things you could focus on.
This is particularly relevant for the postdoc that beginning to develop their own supervisory skills and beginning to in the postdoc year learning about what it's like and experiencing what it's like to be a supervisor. So in some cases we have the postdoc doing some supervisory experiences with our pre-doc interns as providing that as a graduated experience for the total package of a psychologist.
That's excellent. And I would be remiss, since this is the Ethics and Psychology podcast, to not mention ethics. So hopefully that when supervisors think about ethics, that they immediately think about the Ethics and Psychology site, which is at www.ethicalpsychology.com. It's very easy to remember. But also in terms of ethics, it's not just the rules and the regulations and the case law, and it's not just the APA ethics code and the APA guidelines for psychologists, but it's also ethics as providing the highest quality of care. And Sam, you've been a leader in positive ethics. So any thoughts about reaching for the ethical ceiling?
Yeah, I think it's a good thing to do.
I agree with you, and my hope is that supervisors who are listening to this think about ethics not just in the rule-based manner, but also in the ways that you can see ethics as a higher calling and trying to do your best rather than trying to do just enough to get by. And there are plenty of examples of this on the Ethics and Psychology site. Okay, so we're going to move to self-reflection and supervision, and we've been talking about this for off and on for most of this section. So self-reflection, it refers to a deliberate metacognitive process whereby individuals strive to observe or monitor their thoughts, feelings, attitudes, and behaviors with as much objectivity as possible and with the goal of self-improvement. So Sam, why is self-reflection so important then?
We are all prone to biases and blind spots, and as much as we can reduce them, the better off we're going to be. There's a number of studies which have been done. Well, you have them listed here. There's cognitive biases, confirmatory bias, and so on. We also have implicit prejudices. Even people who strive to be fair and just in their behaviors towards people who are different will, just by the virtue of living in the culture we do, will pick up some implicit biases. It's important to know them. I was reading an article, reading some articles recently where there's a tendency when you look at someone who is attractive to minimize their pathology and minimize the pain that they're in. And even though it's a benevolent attitude, you're attributing positive things to this individual who's attractive, you're actually being unfair because you're minimizing the amount of pain they have and the number of problems they have. There's studies which have shown that psychology trainees, and I'm sure this applies to psychologists, are more likely to pathologize and have negative attitudes towards people who carry excessive weight. So there's all these different ways in which we have biases and emotional reactions that can be harmful and have an impact on patient care. And to the extent that we can minimize those blind spots, the more effective we're going to be.
Right, and I think just by being human and the way our brain works as well, not only are we influenced by culture, but we think heuristically. So we don't think in algorithms, and since we think heuristically about many things, we're prone to biases because of the heuristics that we use. So it's important, I think, Sam, that you said that not only is self-reflection a tool that needs to be used on a regular basis, that the hope is that this will then lead to, as you alluded to, higher quality of care.
Yes.
So if we are seeing the situation, if we're living the situation, if we're hearing the situation more accurately, we will have better interventions, and hopefully that leads to better outcomes in treatment.
There's a very good book called Every Patient Tells a Story by Lisa Sanders, a physician in New York who deals with high, complex, difficult cases which have been a series of treatment failures. He says the number one reason for treatment failure is confirmation bias on the part of physicians. Some physicians in her situation will say to the residents, don't look at the diagnosis that the patient got in the emergency room. Don't look at the diagnosis that the patient got from the PCP. Look at the data and formulate your own opinions. Don't be biased by that.
And so how would you promote self-reflection, Sam?
Well, we have the model self-reflection as a supervisor. You begin to ask questions yourself. You ask open-minded, non-judgmental questions. There's self-reflection exercises. For example, writing journals, writing diaries about what you had, what you experienced during the day. And our colleague, Jess Sternlieb, suggests that when you write these journals, and he talks about writing journals or diaries and then talking about them in a group, he says what's really important is not to summarize what you wrote, but to actually read what you wrote with special attention to the experience, the emotions that you had, the sensory details. It makes it come to life, become more attuned to what the emotions were actually activated by the experience.
Right, and I think these types of exercises and activities, not just for postdocs, but for early career psychologists and mid-career psychologists like myself and late career psychologists like Dawn, it could be good for all categories of folks.
In a manner similar to patients, you don't. I think the non-judgmental attitude is very important. People want to look good. They're striving to do their best. Any feedback you give should not be focused on them as a person. You don't say you're stubborn, you're not astute. You need to focus on the behavior. And one way to facilitate these discussions is to push the self-reflection on the supervisor immediately. Say, okay, thinking about this, what do you think went well? What do you think went badly? What do you think you could have done differently? What do you think you've done well? You want to focus on not only failures but successes. You can learn from successes. Okay, what was there in this experience that made it successful? Are there other situations where these kinds of behaviors can lead to success? And then you look at failures as well. The term is sometimes used as a good error. An error is good if you can learn from it.
I notice too sometimes, Sam and John, that again, particularly with the pre-doc interns during their first, usually their first quarter of the internship year, they are very nervous about doing something wrong. It's almost like the above all do no harm is primary in terms of their ethical mantra. But then after a while, they're more free in terms of discussing if they did something wrong, why they did it, and what was their thinking in service of then trying to improve it. So there's that developmental quality in the intern and the postdoc resident that if you can, and frankly, I sometimes as a way of fostering that, will share my screw ups, and I have some legendary stories about that, but as a way of saying, well, this is what I was thinking at the time, but as I look back on it, boy, what a dumb thing that was to do. And it kind of softens it and makes it a little bit easier for them to then discuss what their thinking was, because we have been very fortunate both with our pre-docs and post-docs that we haven't run into anybody that's really intentionally harmful. They're just normal misjudgments, and gosh, you got to be able to learn from them, but you can't learn from them if you don't admit to them and talk about them.
Right, and that's something we covered in, I believe, episode 2. One of the things that supervisees are not want to do is discuss their errors. Yeah. So, and it makes perfect sense. But and Don, I'm glad you're admitting to what your errors are, because I
have 3.
I was going to say that because when they see you doing the errors, it's probably easier after you've disclosed you've made errors in the past.
Yeah.
Don't worry, you can hit me at the convention.
I will.
That self-reflective attitude is very good, and as long as the error isn't horrible, you can learn from it. And what I tell people is the best you can do is based upon the available information you have at the time. Sure, you're going to make mistakes because of lack of information, or sometimes it's because your thinking process is faulty. But our standards for yourself should be realistic. You can't expect to help everyone, and we will make mistakes. One time I was at a banquet, annual banquet for a group practice, and an individual received an award for being an outstanding employee. And the supervisor, the director, pulled me aside and said, "I called you about that person 15 years ago." I said, "Oh, I didn't realize. Yeah, they'd done this and this and this. And we were thinking, do we need to let the person go?" And I said, "Well, do they feel bad about what they did? Are they going to learn from it?" "Yes." "Well, okay, keep them on." And then, years later, the person's an outstanding employee of the agency.
Mm-hmm. Right. Well, Rick Small, Michelle Mealy, and I did a presentation on how to learn through clinical mistakes. So I think that is important for people to have the attitude and the perspective that, right, we are human. Just like I said before, we think heuristically, and when we think heuristically, we don't think in algorithms, and we will make mistakes. The hope is that through our training and experience and supervision that we don't make major blunders, but sometimes that does happen too. But I guess the goal, though, as you're saying, Sam, is there's a difference between making a good mistake and a bad mistake, and a good mistake is one that you can learn from. So let's move on to supervision realities and supervisee remediation. And we spent a lot of time in episodes 1 and 2, or parts 1 and 2, talking about supervision as a skill that folks need to develop and build. It's becoming a specialty, and I think at some level that's what the State Board of Psychology wanted by asking folks to get at least 3 credits in supervision to do appropriate supervision with postdoctoral psychologists or residents. And supervision is not always easy. So that's again, Don, why we have you here. Hopefully you can share some stories, not nitty-gritty stories and ones that would embarrass people, but supervision can be difficult, and supervisees can be harmed in the process. Not that you've harmed anyone, Don. Supervisees can be disappointed in the process. Supervision may be more complex than envisioned, and supervisees will seek out supervision when and where possible.
I'm not aware of any harm. But,
good.
But that's fortunate. Well, I'm going to do a little bit of self-reflection here because in our we are a private practice. We're not a funded facility. We're not an institution of higher education. We are a group practice that gets paid based on the amount of billable services that we do. We don't get paid for doing supervision, and it's important to recognize that that can lead to sometimes some frustration, some edginess on the part of the supervisors. Yet if you sit back and think, well, why are we doing this? Our philosophy is to give back to the profession. Plus, we just love it to death. So it is complex. It is important to realize that you as a supervisor have certain expectations, and if you have supervision set up on a Friday afternoon at 1 o'clock, which I routinely do, and something comes up, there's disappointment felt on the part of the supervisee. There's disappointment felt on my part, and there's obligations to try and make that time up and so forth. So there is a reality to this. You only get so many hours out of a day, and there's often competing time for those hours. The other issues, though, about the quality of supervision and the experience of the supervisee, you certainly hope to, if you set the tone well enough, that they're going to be willing to bring that up to you. Now, of course, you do have the power differential, and so that's not always quite as free as you would like it to be. But it calls on you then to also to be able to look at and be sensitive to the supervisee. For example, if they come in kind of unprepared, or they're always a few minutes late or 15 minutes late, or they're the ones that are saying, can we reschedule this to another time? This last point here, supervisees will seek out supervision when possible. The one benefit that we hear continuously back in our feedback requests from our supervisees is that it's good that there are 7 of us, because somebody is always available, that there's a door that's always open, that if your primary supervisor or your secondary supervisor is not available, you can walk in to a licensed psychologist's office and somebody will spend some time with you to go over things.
And that's a great benefit to have, and that's a great part of your model.
Mm-hmm. But again, there are the realities of, especially in our kind of situation where and not everyone, we have seven people, but not everyone functions as a primary supervisor. We sort of take our turns, but not everybody picks that up because they say, I just have too much to do, and that's fine. I would rather you do that than try and take on a supervisee and then be disappointed and then develop your own reactions to, oh crap, I have to deal with this supervisee for this hour and I got a ton of other things to do. That you as the supervisor need to be aware of what your priorities are.
Right, and that's what Jay Mills had said in the other podcast is that it really is a labor of love, so to speak, is that this is something that does take a lot of time, energy, and effort on the part of the supervisor. So that we don't end on a down note, I think we're going to end up with this slide, which is ways of enhancing effective supervision. And Don, you already talked a little bit about this, is about mutual agreement about supervision goals. So you talked a little bit about, informed consent and some of the things that happen in your practice. Another thing to understand is supervisee personal issues and values that influence their work. Also rolling back into the informed consent and the supervision contract is that mutual agreement of supervision tasks. Understanding how the supervision time is used, that you're going to use recordings, and how you're going to do the documentation. At some level, supervisee induction, which these 3 podcasts might help folks out with. Developing appropriate conflict resolution skills, helping manage emotions and expectations, just as what you were talking about, Don. The use of empathy, negotiation, and cooperation in supervision, as well as emotional bonding, which includes mutual respect and trust.
And if I had to rank those, I would probably put the mutual respect and trust as number 1, because if you're going to accept the role as a supervisor, you have to accept. It's done best if you accept the trainee as a future psychologist, as a colleague of yours, that you're there to help and guide rather than to punish and berate. Certainly, I've had some personal supervisory experiences where you walk out of the session and you go, boy, I don't know anything, and they tend to beat you up. I don't find that a particularly healthy learning environment. So respect, trust. Of course, if you make that obvious to the supervisee themselves, then they bring that to the table and they say, well, I'm going to take a chance on this. I'm going to say, I'm not getting what I need from this. Can I do a little bit more of that? And that's so much the better for it.
All right. Well, as we've run out of time, I want to thank you both again very much. Don, thank you for taking time and
Pleasure.
And being a good sport about things. You've always helped out the podcast, so I greatly appreciate your time, energy, and effort. And Sam, thanks for helping to pull all this material together. Thanks for hanging in there with the technology. And any final words, gentlemen?
Looking forward to the next one.
Yeah, thank you very much, John.
All right. Thank you, Sam. All right, folks. So until the next time, do the right thing.